This is the second time my country of South Africa has hosted, and that's not an honor. And that's not something that we should be proud of. We shouldn't have had to host this conference again. Please, please, please understand that I don't mean to insult anyone here or belittle the extraordinary work that has been done by this amazing community over the years. I have seen the impact of your work firsthand. I have been personally inspired by your commitment to this fight. Countless millions of people would have died without your dedication and your compassion. But I think it is time that we acknowledge that something is terribly wrong.
The only medical credential I can claim is that of a retired junior assistant to the great surgeon of the soul, the one who lives within us all. I have read of the breakthroughs your community has made in bringing HIV under sustainable control, in the provision of treatments and development of trial vaccinations.
We know today that we have got 17 million people who are on treatment. And still we have got 20 million people who does not have access to treatment. Another 20 million people still need treatment currently and as a matter of urgency. The main task before all of us gathered here is to ensure that additional 20 million people have access to treatment, and not just treatment, but also all healthcare facilities and support as our human rights. At the place where I'm coming from, there are challenges in terms of accessing ambulances to go and get access at the hospitals. Sometimes you go and you find that you don't have, there is no medication at the health facilities. Those who doesn't have money, they don't even manage to can go to another health facility to can access the service.
In 2000, the IAS made the decision to hold the conference in Africa and in, of course, South Africa, in part to address the huge numbers of human beings living on this continent, living with HIV infection and, of course, untreated. But also we came to address the AIDS denialism then blocking prevention and treatment. After Durban, the treatment era and the goal of universal access can truly be said to have begun. And now, 16 years later, we're back here together in this wonderful city, and South Africa now has the largest treatment program of any country on earth.
There are countries like South Africa where HIV has fundamentally changed the burden of disease, where it has significantly altered the expectancy of life, where it has also depleted health resources and put social support system under extreme and extraordinary strain. This virus has challenged all of us. It has required of us that we reconsider many of the beliefs that we long held to be true. It has made us confront our prejudices. We have had to change the way we respond to epidemics. Countries have had to redirect resources from other areas of critical need to address this new challenge.